All right, Lee, let's go on to our next topic. I'm going to label it protecting care, not just assets. I've heard you say a few times since you've joined Alert Enterprise that security in healthcare isn't just about protecting the assets, it's about protecting the care. That's a really powerful statement. I'm just wondering if you can unpack that a little more for us and explain what that means.
Sure. So everyone knows there are incredibly expensive assets that are in a hospital. They're worthy of protection. There's a case in California where $250,000 worth of skin graft equipment went missing. So obviously there's assets in every room. Infusion pumps go missing all the time. So that's worthy of protection. That affects us all and that affects our care. But then there's the care team. Will is there. Will needs the attention of someone. They are historically understaffed and that situation is not improving. So we need to protect the care team. The second part of that, Will, is you and I, when we are there, we're worthy of protection.
Mm.
That's the last place you want to be with your child. And also Mr. Creepy is in there with your child. You know, that your care and when your children are there is of a safe nature. So it is absolutely about protecting what they'll call the care team. That's everyone that has to come and go on that facility. And then that's you and I when we're there. That's you and I when we are not the patient, but we are just a visitor to a patient. There is and should be an expectation of safety and security in those facilities.
Yeah, I love that. You had mentioned previously about workplace violence as one of the kind of drivers around the enhanced security in healthcare. As I think about that, you think about technology like patient visitor management that gives us a new way of automating safety and security around care of patients and their families, as well as staff, by looking and ensuring that there is compliance around who's coming in and out of the building. So how do you see things like patient visitor management or AI or other components of technology around security reshaping the way the healthcare environment is evolving for both patient and staff?
A good question, and I'll take it in two parts because AI comes on with whatever technology you bring. First and foremost, if we're talking patient visitor management, even if we're getting into employee and contract management, as we're managing all those physical identities, the takeaway is that is the front of the organization. These aren't my words. These are words I've heard over the years from healthcare security professionals. You know, Dr. Will, when you come there and you've agreed to work at this facility, your first introduction to that facility and what they are like and how they do business is how they onboard you. And his words to me was, I don't want this to feel like a Department of Motor Vehicles. No, this is a real thing. You know, it was in a dark basement and you do this here, you do that there, you fill out this paperwork. And he said, I wanted to feel like a world-class organization. So you think about that, Will, like Dr. Will, Nurse Will, et cetera. That is the front of the organization to you. So that's super important. And then what should be a given is how something like patient visitor management is the face of our organization. When an organization chooses to do something like that, it is not a decision that's taken lightly. It's not something that is just ever handled by security or patient experience. It is an organizational shift. This is our front door. This is our greeting. This is, hi, how can I help you? Like it changes everything. There's signage. They do a lot of times the successful organizations will do local media reach out. Like that tells people we take things seriously here. It is technology based. And like we said previously, it is a bit of an assumption that you care about my safety and security. But in answer to your question, like what does that mean to a hospital? It means everything. That is your first introduction. If someone says, Will, come here and see mom, the first thing you're going to do is be greeted by someone, hopefully, who is going to make sure you are Will and going to tell you where mom is. So it's everything.
That's amazing. And so if I hear you correctly, it becomes part of the brand and messaging of the healthcare organization by that first impression. It creates that positive first impression. That's really powerful.
Yeah. And remember, both ways. That's you being onboarded as a contractor. Often the case when these teaching facilities, you're just a student. As you're being onboarded as a student, doctor, nurse, whatever, this is your first impression of where you're going to spend a whole lot of time. So you want that to be one of a positive nature. You want to feel secure. You want to feel latest and greatest, all those things you'd like to feel.
That's great. So that's just another example of how security goes beyond just the security component, but also as a business enabler for
Oh, good point.
efficiency and as well as brand. That's, I think, a win-win for everyone.
Last point on that one, as you talk about a business enabler, and we talked previously about the care team, that is everything to a hospital. Qualified, decorated care team. And we talk about a business enabler in some place where nurses are striking and nurses are leaving. One of the great security influencers in the space, Brian Warren, told me years ago, and I never forgot. A good nurse that doesn't feel safe will leave. What
Mm,
does that do? What does that do to a hospital? You know what I mean?
mhm,
She'll go across town. And what does that
mhm.
leave you with? That leaves you with potentially the ones that were not up to snuff that can't make that call quickly. So he told me that it was very powerful. I never forgot it.
Wow, I didn't even think about that. So even employee retention by
Absolutely.
creating the environment, creating the situation where they feel it's safe, but
Yeah.
also that
Yeah.
it's modern and
Yeah.
efficient. Yeah, that's
You know,
great.
in New York, there were nurses in the street on strike, thousands, and three things made the news article, and one of them was safety. They're
Mm,
absolutely asking for it, and because of how often they can be employed in all the various places, it's ranked as a top profession, but it's also one of the most dangerous. And they know it, and they're asking for protections.
that's personal for me. I have a lot of family members who are nurses, and so that
Absolutely.
makes a lot of sense.